Garcia here, one of the sports and shoulder surgeons. Today we're going to show video testimony. This is a young girl. She has hyperlaxity, and these are kind of difficult to take care of because you'll see when from her testimonial, she's had one failed surgery on the surgery side to be fixed and two on the other side. They come in with really a lot of anxiety. They're pretty stressed about their shoulders and their problems because it's hard for them to get taken care of. And some are not taken very seriously because the MRI sometimes can be negative. It's really more of a capsular laxity thing. When they have multidirectional instability, what we try to do is PT first, exhaustive. And she did that over a year, still struggling. So we have newer surgeries and newer techniques, which we've shown a few times, to do this with pretty good results. And you can see from her, she's quite happy in a very difficult situation. And she was able to achieve the things that she wants to do, and now she can move on with her life. Hope you enjoy. Thanks.
Leading up to the surgery, I had a history of multiple shoulder surgeries in both my shoulders due to subluxation and laxity with no actual injury. And the year leading up to surgery, I went to practice, trying to get an ortho to believe what I was telling them, to listen to what I was saying instead of what was being shown on the MRI results. And that is going my history for literally every joint problem I've had. And it's been really frustrating, and I was worried because like I said, I've had, before this surgery again, I've had surgery on this shoulder and this shoulder twice. And having to go through another one and having to worry about it failing again and having to go through the procedure again, was a lot of stress on top of just like not feeling heard. Anytime I relaxed my shoulder, it would just like slide out of socket. I was afraid to use it. I'm an athletic trainer, so I need to have use of my shoulders. I didn't trust my shoulder was capable of doing my job. I was so afraid to just remotely use it to grab anything, afraid that I was going to cause my shoulder to come out of socket. So that just general deep sense of fear and mistrust on my shoulder was huge. After talking to you, it was the first time in my entire medical history where I truly felt listened and heard. You having that game plan and telling me that we did not need to do yet another MRI after already having 2 done in that previous year, plus a CT scan. You already having a game plan, looking at my shoulder and not just basing off what you were seeing on the MRI, but what was being said meant the world to me, and that just general sense of trust. So it's been a little bit long, but again, due to my history, that nothing about that surprised me. I knew it was going to be a little bit longer of a road for recovery just because my shoulder was so loose and not stable that he went in and really tightened up that shoulder. But for the most sense, it's been great overall. Worked through a lot of that fear and anxiety about using my shoulder. It's becoming easier to do my job, trusting that I can show exercises, that I can eval other patients without having to completely compensate for my shoulder. And so overall just being more active and being able to do the things I enjoy in life. This surgery so far has been everything I could hope for. I do not feel that sense of instability. I'm not afraid to use it. It is everything that I was hoping was going to happen, and I'm really hoping it stays like that for the foreseeable future because I never want another surgery again.
If somebody came in with the same issue as you, would you recommend this procedure to them?
110%. I've already told people if they have shoulder problems, I already know exactly who I was going to refer them to.